welcome back. We are back on another Monday for an episode of Sip with Joy. And if this is your first time tuning in, welcome to Sip with Joy, a show about a girl, her wine, and her feelings. And I am that girl. I am your host, Joy M. Hutton. You see the J and Major Co back there. But anyway, serial entrepreneur and lover of food and wine. And welcome back, guys. And speaking of wine, you know how I do. Today I have a Syrah. It's from Washington State, so I can't wait to talk about that. So if you follow me on Instagram at Sip with Joy on the Sip with Joy page, I have the sip of the day. I've only had one sip. I do the sip of the day where I talk about this wine, and you can learn more about what I'm drinking. So, without further ado, I don't want to keep us waiting because, listen, today's episode, and I did not take my sip, so hold on, wait. Today's episode is titled It's Getting Hot in Here, okay? I am going to be joined by Dr. Uchenna UC Ossai to talk about the changes men and women experience in their bodies as they get older. And it's so funny because I've been getting so many DMs from guys and they're like, "Well, what are y'all really going to be talking about?" We're going to be talking about the changes we go through in our body. Erectile dysfunction, menopause, high libidos, all that stuff. So, UC, she goes by UC, is a sex positive pelvic health physical therapist, sexuality educator, and certified sexuality counselor. Okay, so she gets into the conversations about sex. All right, she is also the creator and founder of UC Logic, a sexual health platform for adults rooted in an intersectional framework that focuses on improving sexual joy. I love that. Erotic intelligence and autonomy through innovative education and community building. So we're gonna get into it with Miss UC. Hello.
Hello, everyone. Hello. Hey, Joy. How
Hey,
are you?
hey, I'm so good. I'm so excited that you are here. I was like, oh my God, please be available. Because this is such an important topic, and I don't think we talk about things enough. Hey, Robin. Hey, LC. Hey, Jess Lee. And so I'm really excited to get into these topics with you today. But before we begin, I got to ask you what you're sipping on.
I'm sipping on a blend, Texas blend from Calais
Oh,
Winery
okay.
in High, Texas. Calais wine is my favorite wine to date.
Okay.
The winemaker, his name is Ben Calais. I highly encourage you all to go in the droves, order it, buy it. It's delicious. It tastes like a treat in a glass.
Ooh,
Truly.
okay. How do you spell his name? How do you spell?
Calais. Calais
Oh,
wine.
Calais. Okay. Yes. Okay. Well, get into it, guys. Calais wine. Go get you some. Yes.
Yes.
I love it. Cheers. Okay. So we're going to jump right into it. So I make jokes about my libido being high, and people laugh at me all the time, but I'm actually dead serious because as I've gotten older I feel like a horny teenager. And I'm like, this started happening to me like around 35 when I was going through a divorce, and I was like, is it because I just haven't been out here in these streets, or is it because I'm getting older? So can you talk about like the high libido thing? And then I talked to other women and realized that it wasn't just me, it's a thing.
Absolutely. So here's the thing about libido, and I want everyone to think about this, is that your libido is a truth teller.
Hmm.
It doesn't matter what gender you are, who you are, your libido tells you the truth. And it also informs, what we know about sex, the permissions we give ourselves around sex. Our
Hmm.
libido also is a signaler of what's going on in our bodies physically as well as emotionally. So that's a huge part of your libido. And
Mm.
particularly women, especially as they get older, there are lots of components. There could be components of you're more comfortable in who you are as a human being. You understand your body a little bit more. You have more information. Maybe you grew up in purity culture right? That now that you're kind of coming away from that, you feel
Right.
more autonomy and growth,
Mm-hmm.
and that can spark that. Sometimes if we're in relationships for a long period of time, that may or may not be feeding us emotionally.
Mm.
And then when you're out of it, you're like, you feel like you're free as a bird, and you're like, where did, like, I didn't even realize I had a libido.
Right.
And then when we think about qualifying our libido as high versus low, what is that? What is your benchmark?
Mm.
Is your libido really high, or is it that you're just really curious and you're feeling freer to ask questions and to explore? And so it's highly individualized. So when people say my libido is really high, I'm like, great. If that's how you feel, great, then that's fantastic. But there's nothing wrong with that. I think
Right.
physiologically too, what's happening is that you're having a change in your hormone
Mm-hmm.
flux. And for some people, as their estrogen increases or their estrogen decreases, some people their libido tanks, and some
Right.
people their libido increases.
Mm-hmm.
And sometimes the libido is also a direct responder to the stress we're experiencing. So for
Yeah.
some people, just like anything, some people, if they're highly stressed, they have no hunger. But other people, when they're highly stressed, all they can do is eat.
Right.
Right. And so depending on who you are, you might be a person where you're like, I'm hungry for some sexy time.
Right. I need
Right.
it right
You're like,
now.
I don't that doesn't even enter my brain space,
Yeah.
right? So a lot of it, and then also too, what's happening medically too. So some people might be changing medications, so they may be on birth control for a long period of time,
Mm-hmm.
and that can actually suppress your libido.
Mm.
And so when they're off of it, their libido spikes, and they're like, "What's going on? Oh my gosh!" And then some people, there's lots of other factors that can be happening medically that can explain it as well.
Right. Interesting. Yeah, because I'm like, what is going on? Somebody tell me something.
But
um,
one more thing I want to say about like
yeah.
high libido is that I think that when a person, particularly women, when
Yeah.
they are like, man, my libido is high, what's going on?
Right.
And the thing is, your libido might actually be like normal. It may be that your partner's libido is low compared to yours,
Ah,
right?
that's
And there's a
true.
libido discrepancy. Isn't that interesting? So when women have a high libido, it's high, right? But if their partner has a high libido, then it's not that the partner has a high libido, it's that you have a low libido, right?
Right.
And so you have to have a discussion about, oh, is it just that we have a libido discrepancy? Or
Mm-hmm.
is it that you're just like, I'm not even partnered. I'm just like wanting sexy time all the time. And I'm just curious and wanting to explore that. And I think all are good and great. We just need to think about what we want, and is it serving us in the way we need it to.
Yeah. Okay. That's a good perspective because yeah, you're like, is it the partner's libido is lower, and that makes it seem like mine is high. So that's interesting. Okay, so next question. So Tabitha Brown recently opened up about her experience with perimenopause, and she was like going through it. She was on live, and she was like, "Listen, y'all, I'm sweating in my stomach and my armpits as we speak. Like I'm going through it. I want to have sex sometimes, and then the body is saying something else, and she was just going through it." So, can you talk a little bit about that? Because I don't really hear a lot of women talking about menopause in general. It's just when it happens, it's the hot flashes. That's really the most that you hear people talking about hot flashes and whatnot. So, can you talk a little bit about that?
Absolutely, absolutely. So I think first is to clarify like what perimenopause is and what menopause is. So perimenopause, I tell people to think of it as a transition phase.
Mm-hmm.
And it can take years where your ovaries are slowly shutting down in their production of hormones. And so you see that slow decline of estrogen. And this is usually the time, this is what Tabitha is talking about. This is the time where people have what we call vasomotor symptoms of menopause. So it could be night sweats, hot flashes, body aches, loss of appetite, low
Hmm.
libido, vaginal dryness, all of the things can happen.
Yeah.
Long list of things, sleep disturbance. So those that can be part of perimenopause. Whereas menopause is the absence of your period for 12 months.
Hmm.
It's 12 consecutive months. And so that's why I tell people that perimenopause can last a long time. And then some people you know, have a really hard time with certain symptoms like Tabitha was talking about, where she's having hot flashes all the time. Whereas someone like
Yeah.
my mother, I think she had one hot flash
Right.
That was it.
Yeah.
And she didn't experience vaginal dryness. She didn't have urinary, what we call genital urinary symptoms of menopause. So some women experience dryness in the vaginal walls,
Mm-hmm.
increase in symptoms of urinary incontinence or fecal incontinence or prolapse symptoms. And so everyone's really different. So the first thing I want people to know is that if you're starting to feel, changes in your period, whether you're having a heavier flow, lighter flow, or any of the other symptoms I'm talking about, speak with your practitioner who focuses on your genital health. So a women's health practitioner or a gynecologist or a nurse midwife, PA, NP, and just ask them, hey, because sometimes our gynecologists, they're experts on our genitals, but not menopause. And
Right.
so you want to ask, hey, are you also a specialist in menopause? Oh, no. Well, is there someone you can recommend that I can consult with? Just to make sure that someone's tracking you as you go through this process. Because if you're starting to have really symptoms that are bothering your ability to function and be happy and
Yeah.
thrive,
Mm-hmm.
then you want to have that managed. And sometimes it can be simply just topical estrogen. And that topical estrogen is something that you would put in your vagina. It can be a cream. It can be what we call, a suppository that you put in there and it kind of puts the estrogen, give you a little bit of estrogen love. So it makes the vaginal tissues happier. It could be systemic estrogen. It could be testosterone. There are lots of things that they can do. They can do bioidentical things. So wide range of things that can be prescribed for you. But I
Mm-hmm.
highly encourage you all to not, just because your friends might have X, Y, and Z that is prescribed to them, it doesn't mean that that's right for you. So
Right.
with someone who's a specialist who can evaluate you on an individual basis is really important.
Good points. Good points. One size does not fit all. So we're talking about perimenopause, but this is also a conversation around men and women. You know, the challenges that we both face as we get older. As we get older. So what are some other challenges? I know we have, ED, also known as erectile dysfunction, which a lot of people don't want to talk about. And I hear a lot more men, coming out on social media and talking about it, but it still is something that a lot of people are just not comfortable talking about. And then men are hiding it in relationships and making it seem like it's the woman, and it's like, no, it's because of you. No. Come on, bro. No, no, you need to get that thing checked out. Don't be trying to blame it on the woman over here. So, can you talk about, some challenges that men face too, and then other challenges that women may face?
Absolutely. And I as a clinician, this patient population with ED was one of my favorite populations to treat because it was always a mixed bag. It was a
Yeah.
choose your own adventure type of situation. And so one thing that I want people to recognize is that erectile dysfunction can be characterized many ways. So it could be your inability to achieve an erection, or
Mm-hmm.
it can be an inability to not sustain an erection. So you might be able to get hard, but it's just not right. You can't keep it, or you
Right.
can't get hard enough for penetrative intercourse, which is if that's the desired outcome
Mm-hmm.
for your sexual encounter.
Right.
Because not everyone's trying to penetrate. Sometimes they're just wanting to masturbate.
Mm-hmm.
Now, what we also have to understand about erectile dysfunction is that, let's just think of it from a biological perspective. It's a lack of blood flow to the penis, to the shaft of the penis. And what impacts blood flow? Our muscles, right? Our blood vessels, the nerve function. And so for people, so things that I want people to think about, from a medical standpoint, from a physical standpoint, because we're going to talk about the psychological piece as well, is that if you have chronic back pain, if you have chronic constipation,
Mm.
if you
All
have
these
a lot
grown
of
folks,
these
all these grown
issues,
folks problems.
these issues,
Yeah.
those actually can like lend themselves to like developing erectile difficulty. If you have
Oh wow.
cardiovascular issues, if you have diabetes, if you like, all of those components are super, super important because all of those things impact blood flow,
Mm-hmm.
impact nerve function, impact muscle function. And remember too that your pelvis, at the bottom of your pelvis, is your pelvic floor. It's a
Yeah.
group of muscles. And your muscles are it's skeletal muscle. So it's a muscle, it's a blood pump. So if
Mm-hmm.
you're a person, if you're stressed all day and you're clenching, right? I always tell people, if you're holding coal in
Yeah.
your butt, right?
Mm.
That means that all that blood flow that's
Yeah.
supposed to go to your pee isn't going to your pee.
Right.
And so then if you're stressed or worried about
Yeah.
money or work or family stuff, and you're just all in your head about it, and you're holding tension in your pelvis and you're not aware, it can be
Mm.
hard to experience an
Release.
erection that
Yeah.
is satisfactory to you.
Absolutely.
And another key thing, and I will tell people this time and time again, one of the primary issues that we saw with ED was depression, anxiety, and particularly
Mm.
performance anxiety.
Yeah.
Those can wreak havoc on your sexual functioning if you have a penis. And that, I think people really underestimate the importance of like your mental health and understanding the mind body connection, because
Yeah.
the mind and the body, like, they're one and the same, they're not separate. And if you're
Right.
having those emotional issues, that can really, really impact things.
Yeah, that's tough. I mean, nobody wants to be seen as not performing in the bedroom, so I can
Absolutely.
imagine how tough that is. Um, because this, yeah, it's it's a lot, and then we're going to talk about the shaming piece later. But yeah, I agree with everything that you're saying. So you mentioned masturbation earlier. So is there a such thing as over masturbating? And that's for, I guess, men and women. Can you lose sensitivity, or you don't want
Yeah.
penetration anymore? Like, is there such thing?
So I think that's a very interesting question. So I always tell people this, because people always ask me about porn addiction too, and
Yeah.
that concept. And
Mhm.
so when you're thinking about, is there such thing as over masturbation, I say if you're masturbating to the point where it's disrupting your function as a person,
Mhm.
that would be a problem. If you're masturbating to the point where you're giving yourself physical pain
Mm.
that's not desired, because
Yeah.
some people like a little pain with sex, but if it's undesirable pain, and if you're losing sensation to the point where you're obstructing blood flow, you're causing nerve damage, that's a problem.
Right.
And so that's where, I tell people over masturbation can be a problem. Another thing too, because some women say like they reach a toy and all of a sudden like they feel like they can't experience the same pleasure with their partner, and they're like,
Right.
oh, I broke my vulva or my clitoris by
Oh
overusing a toy.
gosh.
Now we have seen some
Ouch.
people like have an injury, but that's those injuries are mostly due to like, they're doing other some aggressive things to their
Mhm.
genitals, and usually their tissues can recover, or sometimes you do have some nerve injury, but those are in extreme cases.
Mhm.
I will say this, that a big question that people have is, why is it that I have such strong orgasms with a toy, but I
Right.
don't have as strong orgasms with my partner? And I'm like, well, my hand is not as powerful as a machine that's
Mm.
totally designed for a certain type of pleasure.
Right.
And so that's something to like also recognize. And then
Yeah.
also remember that your clitoris, your vagina, those are just receptacle, different ways that you can receive pleasure, but pleasure is processed here.
Yeah.
So you
Absolutely.
can achieve a very powerful orgasm with nipple stimulation alone. You
Mhm.
can have a very powerful orgasm with anal play alone, with all those other things.
Mhm.
So I always tell people, sometimes when you have that desensitization or you're not feeling it, you might need to change how you're approaching your pleasure.
Mm. Mhm.
Like maybe remove visual input, maybe change auditory input, maybe have like kind of play up to the senses,
Mhm.
right? In different ways, pleasure map yourself in different ways, because your body craves novelty, particularly in women. Your body craves novelty.
Yeah.
So change how you approach it. Even if it's like,
Mm.
let's say you're a person that likes to masturbate laying down, maybe masturbate reclined,
Mhm.
maybe masturbate with your left hand versus your right hand.
Yeah. Ooh.
Those types of things, your body will be like, okay, ma'am,
Right.
okay, ma'am.
Okay, girl. Switch
And the
up.
same, the same goes for men. The same
Yeah.
goes for men and penis owners. Like, look, like this is you're like your body literally is a playground.
Yeah. Yeah.
Play,
Mhm.
explore. Don't do the same thing all the time.
Yeah. I love that. You better. Y'all see where she's
You know,
at
like
today?
you know, like get some ice in that hand. Warm
Okay.
up your hand. Stick it in that hot paraffin, and then like play with your penis, and then it's
Yeah.
like, well, that's a whole different experience,
Yeah.
right? Not hot, hot, but you know what I mean. I'm not asking you to burn your penis, but you know what I mean.
We do not want you to do harm to yourself.
Please don't do that. Please don't do that. And
Oh
just
my
and
God. That is so funny. Thank you so much, Tina. Hey, girl. Hey, she said, great job in keeping the people informed on important topics. Yes, this is so important. Um, okay, so we talked about the masturbation. You touched on porn addiction, and I want to ask, like, can watching porn have a negative effect on people in the bedroom?
Sure,
And how?
totally.
Yeah, like how?
But
Because I think, well, I know I've always felt like you expect me to do all these crazy things and and listen, sir, I'm not about to be doing all these acrobatics and crazy stuff, but I think that there are these fantasies as well, and so that's kind of where that question was leading.
well, and I say sure and like
Hmm.
sure
Yeah.
because here's the thing: porn is entertainment.
Right.
It's and also sometimes it's actually poorly informed entertainment.
Mm.
When you so the way that porn disrupts sex is that it can give people unrealistic expectations,
Right.
and or people use porn as sex education because
Mm.
they don't know how else to access ideas.
Hmm.
And so then they're looking at porn as like an instruction manual. They're like, oh, okay,
Right.
okay. And it's like, don't look at porn like that.
Mm.
Porn is not an instruction manual on how to like change things up in the bedroom.
Right.
Having a conversation with your partner is a great to kind of understand that. Having sex, talking about your sexual fantasies, if you feel safe in your relationship to do so, is a way to explore that. Right?
So
There are a
good.
lot of ethical porn sites that you can access, like Pink Label TV, um, uh, Belisa films. Those are more ethical for like ethical based forms where everyone's getting paid equally. It's realistic bodies, realistic sex. But then people like, well, I'm
Hmm.
not looking at porn for realistic stuff, right?
Right.
And I'm like, right. Right. So it depends on
Fantasy.
like what you're using porn for. If you're like, oh, this is just something fun we like to do, that's totally fine. Oh, it's something that I like to look at every once in a while when I masturbate, that's fine. But if you're
Mhm.
saying I'm using porn as like as the Bible for how I engage in sex,
Mm.
that's problematic.
Yeah.
Especially if that's not the sensibility that your partner has.
Mhm.
If I use porn as the way that I had sex, then I would miss out on the sexual experience with the individual person I'm with. Because I'm assuming that what I see in porn is what they want, and that's not the case.
Right.
Ways to learn about your partner is like dirty talk, sexting with each other,
Mhm.
being like, "Ooh, this is what I want to do to you
Yeah.
tonight." And they're like, "Ooh, that's intriguing,"
Right. And
right?
then
Or
whisper
like,
some
"Ooh,
in your
I had
ear.
this fantasy," and that's a way to get consent. That's a way to get an idea of like how like what your partner is into.
Mhm.
Right? That's a way of building trust. It's incredibly sexy. You can build up that sexual energy. I mean, it's
Yeah.
delicious and it's just no one's modeled that for us,
Right.
right? No one's modeled that for us. And also, everyone is taught in this kind of world of shame. It doesn't matter
Mhm.
if you're a man or woman or non binary person, like, you're sitting in this, like, everyone's doing it behind closed doors
Right.
like this. When really we should be talking about it, be like, okay, is it like I like nipple clamps. Do you like
Yeah.
nipple clamps? And I'm like,
Mhm.
no, but that's great that you do, right? You should tell your partner,
Right.
right?
Exactly.
And so
And not
it's
shaming people for their, yeah, how they like things
exactly.
in the bedroom.
Exactly. I think that exposure to different sexual like ideas are great. Like I always encourage people, try Quinn, Dipsy. Those are great websites where it's like auditory sexual stories. Like you have
Mhm.
different accents, you have different scenarios. You could be listening to that while you're driving to work, on your walk at
Hey, we
night,
don't need
whatever you want.
anybody just driving into the back of a car now. You see?
It's like I would be like driving off the road, like
Right. Oh,
exploding your
shoot.
coffee.
Not while y'all driving. Yes, but
Exactly.
yes. Okay, say that website again. Listen.
Dipsea, Dipsea, and then Try Quinn. That's another, audio sexy stories website that I think is
Ooh,
fantastic.
I love
Um,
it.
and those are great because you can listen, you can get ideas, you can kind of tap into that like sexual energy or
Mhm.
fantasies that you might have. It's
Yeah.
a great way to share. You can share it with your partner. Be like,
Mhm.
"Hey babe, I listened to this. This got me going. I
Yeah.
loved this." And that's a really fun way to just like explore, and it's another avenue. It's
Right.
not for everyone, but it could be for some of y'all.
Yeah, absolutely. And everything is not for everybody, you know.
Yeah.
Um, okay, so let's see. Um, how can we go about not shaming each other in the bedroom and being more sensitive to the changes that we may be going through as adults, older adults, more seasoned adults?
Yeah, I think it's about like putting on your own oxygen mask first.
Yeah.
I think people like I think a lot of us, most of us, started our sex lives with different levels of information and self permission.
Right.
And I think the more we give ourselves grace in the learning process, because learning about sex is not only relegated from ages 13 to 18. Like
Right.
it's a lifelong process. And I think that's the
Yeah.
misconception people have is that, oh, like I shouldn't be learning about sex at 40. Yes, you should.
Yeah, absolutely.
Because you shouldn't be having the same sex at 40 that you were having at 18 or 20, 25 or 30, whatever your sexual
Mhm.
debut was.
Yeah.
Right. And so it's a lifelong process.
Mhm.
And I think that what you should lean on is chasing the erotic, the sexual, the sensual pleasure experience versus chasing performance, right?
Right.
If we think of a good sex life as getting the dick hard all the time, as having like a juicy wet pussy on command.
Mhm.
Sorry, I said, am I allowed to say
I
that?
mean,
Anyway,
this is grown folks, okay? This is not your grandmama podcast, okay?
but like then that's such a limited way to think about pleasure,
Yeah.
right? And if you evolve how pleasure looks over your lifespan, you're going to be so sexually satisfied,
Mm.
right? And there's this great sex educator, his name's Al Vernacchio, and he talks about how sex needs a new metaphor, that it really shouldn't be about baseball. Like, oh, did you get to first base, second base, third
Right.
base, fourth base, or home run? It should be like, what do you like on your pizza?
Yeah. I love it.
Like a thin crust with pepperoni, sausage, and peppers. Okay, you don't like a thin crust, like a pan crust. Okay,
Right.
pan toss. I can do that. I just can't do thick, right?
Yeah.
Like this is how. And then you guys create a pizza that you like, and the
Yeah.
pizza you liked 5 years ago might be different.
Yeah.
You might have developed a gluten allergy, and you're
Yeah.
like, I can't do gluten.
Girl.
I don't do gluten anymore.
Oh
Like
my
you see what I'm
gosh.
saying? We can't be so committed to the pizza we liked 5 years ago or even 5 months ago. We just have to keep that ball rolling. We need to keep checking in with each other.
Yes.
And that's how we were open. And
Yeah.
it's okay if you don't like something your partner likes. I really need people to get that too.
Right.
It's okay if you both don't have the same fantasy because you're two individual people. They
Yes.
can still have their fantasy. It's just not going to be expressed with you, and don't feel threatened by that.
Right.
Right? I have fantasies that I don't share with my partner, right? But like, it's not because I don't trust them. It's because I know we've already, or I've shared, but it's like, oh, that's something that can live in my brain rent free and I can access anytime I want.
Right.
And there are other things that I engage with my partner with, but
Yeah.
this one's mine,
Mhm.
right? And having that openness and just being like, oh, you know what, babe, like that's something that I'm interested in like looking at, but I don't know. Or maybe you explore it and you're like, oh, that's not for me, and you can just say that's not for me.
Yeah.
And we explored that,
Mhm.
right? And
Yeah.
they can be honored in that, and they can hold that with them, and you guys can keep exploring together.
Right. I
But you
love
never want
that.
to get their yum, or
Yeah.
you want them to yuck your yum either.
Right. Right. Yeah, too funny.
Realize,
No,
I
but
know.
you're right. But you're right. These are such important conversations to have, and like people, people were messaging me like, "Oh my God, you're gonna talk about that?" Yes, I am going to talk about it. I'm a grown woman, first of all, and these conversations need to be had, and we need to have these conversations more with each other, with our partners, because you don't want to find out until it's too late in the bedroom, and then you're like, see, we should have talked about this. you know, we are not
Absolutely.
aligned in between the sheets. So I think that these conversations need to be had, and I think we should be able to have transparent conversations about our sexuality, about how we how we want things in the bedroom, because you may not be compatible in the bedroom, and that's okay.
Yeah, and I will say, I just want to say for people with ED or erectile issues, there are like some things that you could just automatically address right now if you're having ED issues that are very simple that don't or a doctor's visit.
Mm-hmm.
Pay attention to your diet. You know, like if it's heavy in sodium, if it's heavy in like fats, all those things, like eat a heart healthy diet,
Right.
exercise regularly. You really want to get that blood flow pumping. Manage your stress in a way that works for you. So, yoga is great, Tai Chi is great, meditation is great, going for a walk, whatever. But having a regular stress management routine is just essential. Smoking, right? And
Mm.
everyone asks, oh, is smoking weed a problem? All of that. Like if you're chronically smoking all the time, I would say this, like the jury's still out on that because from libido standpoint, we've seen some promising things for like pain manage,
Yeah.
obviously for pain management, but
Mm-hmm.
from a blood perspective, we're still like kind of navigating that. So I would
Mm-hmm.
say take a break from smoking, particularly tobacco, but also, particularly marijuana. Just take a break for a little bit and see if you see a change. And if
Mm-hmm.
not, go ahead and consult with your doctor, see what they think. But those are some really basic things that can really help with your erectile function. And also, instead of just focusing on the performance, but focus on like what you want to feel, what your partner wants to feel, and leaning
Mm-hmm.
into that and lean into novelty and exploration, and
Right.
your penis will respond. And if it doesn't, then definitely see a doctor.
Yes, because we want it to respond.
We want it to respond,
We want it
right?
to
And
respond.
sometimes, and remember, like if you're stressed, if you have medical issues, those things do really impact our sexual functions. Please do not underestimate that.
Mm, that's so good. I hope everybody's out here talking, taking notes. Uh, Thomas said driving, listening to porn is wild. And oh, clutch
Yes.
my pearls. I'm not doing this with you, Thomas. Anyway, okay. Um, what about hormonal imbalances in both men and women? Like, how can that affect us in the bedroom as well?
Absolutely. I mean, OT can affect men and women in terms of their libido, their erectile performance, in terms of particularly libido and erectile
Mm-hmm.
performance. So, what I tell people is like, I'm not a physician, I have my clinical doctorate in physical therapy. Usually, when that happens, when I see patients, they've already been screened for that. They may have been started on testosterone or something
Mm-hmm.
to address that. But you definitely want to consult with your medical provider so that they can get those labs done. They can take a look at what your symptoms you're presenting with, and if testosterone or estrogen or whatever is appropriate for you, and if that can help minimize those symptoms. Oftentimes, you're going to have some physical symptoms associated with it, so it's not just going to be the emotional component. Um, as well. But I also want to say this, some people have ED, some people have sexual pain, all of that, and it's not distressing to them,
Yeah.
right? They're
Hmm.
fine. They're like, do I need to fix this if this doesn't bother me? No, you don't.
Right. Hmm.
Right? So, like, if it's not distressing you, it's not impeding your function, if you're still feeling satisfied, you don't have to address it. But if it's something that you're like, you know what, this is linked to other physical issues, I would tell people to address those physical issues like your cardiovascular health, your brain health, all of
Mm-hmm.
those things.
Mm-hmm.
Managing your weight so that it works for what your body needs.
Yeah.
Because you need to lose 20 pounds if you don't need to lose 20 pounds. But if it will
Right.
help with your diabetes management or your cardiovascular health, try it and see if that makes a difference.
Yeah.
But we just want to kind of approach it from that perspective. But
Mm-hmm.
consulting with a licensed medical provider who specializes in the issues that you're concerned about is really, 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 really important.
Yes. You heard it here, folks. Robin said that's great. Focus on the sexual experience and not just the performance. Absolutely. Be in the moment. Trying to
In the
get to the
moment,
outcome. And it's like, let's be in the moment. Um,
absolutely.
yes. Okay, so we're going to have a little more fun. We're going to do a rapid fire. I love rapid fires. So, first one that comes to mind, I'm going to give you two choices. You pick one. Okay, so you ready?
Sort of. I'm like, my pelvic floor is clenched, but I'm ready. Let's do it. It's like,
Clenching. And I want to know more about this pelvic floor therapy. Okay, we're going to talk about that in a second. Okay, toys or hands?
oh, oh. Hands, hands.
Okay, foreplay or straight to it?
Oh, foreplay. Oh, foreplay.
Bed or floor?
I'm grown, so bad. My knees aren't so good.
Girl!
If
Oh
I
my.
had WD-40, sure, the floor, but
Right, because you got to get up, okay? Oh my gosh. Okay, satin sheets or Egyptian cotton?
Egyptian cotton.
Okay, because
Satin is too, like,
it's
I'm gonna fly
it's
off the
too
damn bed.
hot. It's too
I
hot.
can't. No, no.
Okay, flavored lube or regular lube?
Regular. Don't put nothing
Yes,
near my vagina. I
right.
don't want to use
Okay, me either, child. Don't be doing all that. Okay, shower or hot tub?
shower.
Okay, music in the background, no music.
No music.
Okay, let's see. Spanking or gentle touches?
Spanking.
Okay, girl. Role role playing or conventional?
Role play.
All right. Spooning or don't touch me?
Spooning.
Okay.
Spooning.
You like spooning. Come on,
Spooning.
spooning. Thomas, we are not asking you for your answers in the chat. Okay. Okay, that was fun. All right, so you can find UC at YOUSEE Logic on Instagram. You have to catch up on her Bourbon Tales, where she answers questions about all things sex. And it's so fun. You be getting it, girl. It's the dances for me. And then can you just describe really quickly about the pelvic therapy, the pelvic floor therapy? Like what does that do? Tell us
Sure.
more.
So, the quick of it is that all of us, every human being has a pelvis, and at the bottom of our pelvis is the pelvic floor, and that is anchored at your pubic bone at the front to your tailbone at the back, and it holds in all of your organs, your bladder, your prostate, your uterus, your rectum, the vagina, all of it.
All the
And
things.
so it's responsible for stabilizing your spine, pumping blood back up to your heart, for urination, defecation, sexy time, and babies if you so choose,
Mm-hmm.
right? And it's responsible for a lot. So I focus on treating people who have issues related to that. So everything we talked about, erectile dysfunction,
Mm-hmm.
vaginal issues, rectal issues, any type of pain down there, things associated with endometriosis, people who have cancer treatment where they have rectal cancer, vaginal cancer, ovarian, uterine cancer. I treat all that, urinary incontinence, prolapse. So if your
Oh
organs are
wow.
for women, if your organs are starting to drop down through the vagina or the rectum, that's a
Ooh,
thing. I treat
that's
that. So
scary.
I help get the muscles, nerves functioning in a way that supports your body so you can return to or establish a new level of functioning that
Mm-hmm.
is satisfactory and ideal for you.
Wow, that's amazing.
Yeah.
See, we got to know what's going on with our bodies,
Yeah,
man. Listen, it's a specialist for everything. Okay?
there
There
is.
is no reason why we should not be getting help on anything. So I love this. This was a great conversation. So at UC Logic, YOUSEE Logic on Instagram. What's next for you? Are you working on any exciting projects?
Yeah, so you all should, keep your eyes peeled. I worked on a big project with Planned Parenthood that should be launching here in the next few months.
Okay.
It's a national project in terms of sex education. We're launching some projects. Me and my business partner are launching some projects on menopause and sexual health
Love
later
it.
this year. So we're working on that. So I'm really excited. And then also too, I'm seeing private clients for sex counseling and coaching. So check out my website, uclogic.com, and book a session or a discovery call, and We can
Yes.
chat about things.
Dropping that in the chat right now for you guys. Make sure you go follow UC and listen. I told you all she's amazing, and this was such a good conversation. So good.
It was fun.
I'm
It
like,
was so
listen, I'm
fun.
gonna watch it after I get off. Like, let me get that replay. This was so good. Thank you so much for being here. Show you see some love in the chat, guys. And thank you again. This was such an important conversation. I appreciate you. And
Thank you so
guys,
much.
thank thank you. And so, guys, I'll see you back here next week. We are halfway through the season. Don't be sad. And gonna finish this glass of wine and enjoy the rest of my night. And we are out of here. Thank you, UC. Bye, guys.
Bye.